now talk about Rh negative pregnancy causing fetal anemia. Now this is not that common, but it is important because it can be life-threatening. Now when the mother's blood group has rhesus negative and the husband's blood group is rhesus antigen positive, then this is the condition when the fetus can have a rhesus positive antigen blood group, and hence there will be antibodies produced against that rhesus positive antigen in the blood of the mother. These antibodies then travel from mother's blood through the placenta to the fetal circulation, and because they are antibodies, they will then attach themselves to the antigens on the fetal blood. So what they will do? They will destroy the fetal red blood cells or the RBC, and that will then cause reduction in the red blood cells. That will lead to fetal anemia. Now this is a basic problem. Now what happens is in the first pregnancy when there is this sensitization, or for the first time the maternal circulation is exposed to these antigens, the antibodies which are produced are not as much to cause damage to the fetus. So in most probability, the first pregnancy does not really show as much of an effect. But when there is a second pregnancy and the mother has not received anti-antibody, then the antibodies are already present in mother's blood. And when the second pregnancy happens, then as soon as the first exposure of the fetal blood antigen to the mother's blood happens, then the response is escalated. And these antibodies then multiply at a higher or a faster rate, and they will be increased to higher proportions, and then they will cause fetal anemia, that is disruption of fetal RBCs, red blood cells, early in the stage. Now, if we don't do anything, it's going to be fatal. That is, the fetus will die, unfortunately. So, luckily, our science and the diagnostic and interventional procedures have the knowledge about it. It has advanced to a level where we can now intervene and we can correct. Now, how can we correct this? By doing an intrauterine fetal blood transfusion. Now, what is this complicated term? In simple terms, we just give blood cells to the fetus right during the pregnancy inside the uterus. Now, all of this is done under ultrasound guidance. We get packed red blood cells which are very concentrated, and they are also Rh negative. Okay, so these blood cells, with the help of a needle, we put into the fetal circulation, and they will immediately increase the red blood cell count of the fetus. So we have seen dramatic results like when the hemoglobin has dropped to as low as 2 grams or 3 grams, and immediate correction to 18 to 19 grams is done. So this is the procedure, and this is life-saving because that's the basic problem and we have solved it. Now, as the antibodies are always present in the mother's circulation, if we do one transfusion at say 24 weeks, and if the antibodies are still there, they will go on destroying the blood cells. So maybe in 2 weeks or 3 weeks time, we will need one more transfusion, and then that is how we have to do maybe serial transfusions. In the last case that we managed at GBUM, we had to do 6 transfusions to the fetus, and then because at the interval of 2 to 3 weeks, and finally we could take the pregnancy till 36 weeks, and then she went into labor and delivered. The child is good. He is now 1 year old. He did not need any blood transfusion later on after birth and is doing really well. So these are really those touching stories where we have changed lives or saved lives even before they were born, and given hope to the couple and given a new life which would otherwise have been lost. So this is how we can help these pregnancies, and it's a life-saving fetal intervention which we are equipped to do, and which will help all the couples who have this kind of blood group mismatch condition.